Hi everyone, good morning. This is Dr. Yvette Witten of Adonai Optimal Health and Wellness. I just wanted to share just a quick video with you in recognition of Breast Cancer Awareness Month. So I wanted to talk about the lymphatic system, the significance of stagnant lymphatics, and how lymphatic drainage is important to stave off breast diseases, including breast cancer, okay? So I'm just going to do a quick exercise, which I recommend for my patients, just to ensure that there is no stagnation of lymphatics, particularly in the axilla, the armpits. That's that chain that drains into the breast. Okay, so this is what I generally do every morning, and I hope that you can see under here I have some puffiness, right? So whenever you see under eye puffiness, then you know that is an issue with lymphatic stagnation. So hopefully you'll be able to see, and that the lighting is well enough that you'll be able to see the difference between the puffiness now and the puffiness after I've completed the brief lymphatic drainage exercise. So the first thing I'm going to do is I'm going to take my hands and I'm going to separate my fingers just like this. And then in this space between my fingers, I'm going to just slip that through my ears. Okay. And then I'm just going to pull down very gently. And sometimes it might even feel a little uncomfortable as the lymph is draining, right? If you have any stagnant lymph. Okay, so I start by doing that. The next thing I do is I go to the front of my throat here, and I feel right here where your trachea is and the esophagus is behind. And so right in this space where my fingers are pointing, I go in here and I massage in a circular motion. And I'm going to do this for the count of 30. So I give myself a head start already. So I'm going to start from 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay. And now I'm going to drop down. Okay. So you could go in also. Here's the clavicle. The clavicle is the shoulder bone, I think sometimes they call it, but it's a bone right here. If you just palpate, it's connected to your chest bone, the sternum, and then it goes and it connects to a series of bones here that hold your, that make up your shoulder. But if you just trace it kind of inwards, you'll feel like there's a little indentation here. And so you want to go in there and the same thing, right? 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, then drop down into this space here, which is under the clavicle, right? And that gap where the clavicle kind of meets the sternum, which is the chest bone. You go in here, you'll feel that soft depression here. And then again with your fingers, 1, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, now you're going to go under the armpit, right? Which is called the axilla in medical term. Okay, so you're going to take your thumb and you're going to go, so feel where the clavicle meets up here, which is called the acromion process, but where, you know, with your shoulder, and then just go in and you'll feel like a soft spot right there. That's where you want to put your thumb. And then the 4 fingers go under the armpit, okay? And then you start massaging in a circular motion, okay? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, now we're going to do the other side. What we do to one side, we want to do to the other. So again, palpating along the shoulder bone, find where it meets the acromion, drop down in that soft spot. Sorry, you can see the indentation. Transfer your thumb here. The rest of the fingers go under the armpit. Okay, now you can relax your arm down. You can put your arm across your chest, or you can hold your arm out, whatever you feel comfortable doing. And then you begin to massage. Okay. 5, 6, 7, 8. Now notice that my thumb is massaging as well as my fingers. 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, so that's 30. Sorry, I'm squinting, guys, because the sun is very intense coming through the window right now. Okay, and so the next thing that I recommend is that, you know, you take your breast, right, and hold the breast from the side. You lean forward slightly, okay, which you guys can't see. And then you just pump the breast together, okay? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. I'm going to sit back a little bit. Hopefully you can see. 13, but you're leaning forward. 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay. You also, when you're unclothed, you want to put your hands at your side and lean forward. You want to let the breast hang under the, you know, gravity. And then you want to look for any dimpling in the skin that's very similar to the, you know, the texture of the rind of an orange peel. Okay, so you want to look at it for any dimpling. That is called peau d'orange. And that is a direct sign of the possibility of cancer. Okay, that's one of the signs that we look for. The other thing is you can squeeze the nipples, just you know, gently, but effectively, right? You want to put some pressure on the nipples, and you want to see if there's a discharge. If there is, you want to make sure to pay attention to the color of the discharge and the odor, if there's anything present. The other thing that you should pay attention to as you're, you know, performing the visual examination of your breast is symmetry, right? Are the breasts the same size, the same shape, right? That's also important. And leaning forward kind of gives you the opportunity to look, because, you know, if there is cancer present, you might see some adhesion of the breast tissue. And so it doesn't fall with gravity like the rest of the breast would. That would be something that you would need to call your doctor immediately, schedule an appointment to go in and to be seen. Okay. So again, women and men, right? Men should be also, doing self breast examinations, when their body is soapy, just feeling for, any changes in the breast from one breast to another. If you're not sure about it, when in doubt, guys, find out. That's my saying. When in doubt, find out. Meaning you go and you let your doctor perform the examination. Your doctor is trained to identify any abnormalities in your body. So provide your doctor the opportunity to examine you so that they can determine whether there are any abnormalities or anything that needs to be concerned or further evaluated. Okay, so I'm not sure. I'm going to try to bring my ring stand a little bit closer, but you should be able to see. And, it'll take some time, but you'll see visually that the heaviness and the puffiness in my eyes has reduced. If you don't see a lot of reduction, you can repeat the lymphatic drainage procedure again, a second time. Okay, but in recognition of Breast Cancer Awareness Month, ladies, we are our best advocate. So, definitely make sure that the lymphatics, especially the chain that feeds into your breast, that those are thoroughly drained. Other forms of lymphatic drainage would be rebounding, which means you're jumping up and down on a trampoline. That helps to drain the lymphatic, or drain lymph, I should say. Struggling with my words this morning. The other thing is the Chi machine, okay, or the Vitality Swing. You guys can look that up. And that will help also with lymphatic drainage, moving the lymph in the body. The other thing is the VibraPlate. The VibraPlate is basically a platform that you stand on, and it vibrates the body, right? So that's one way. Also, another way of moving the lymphatics. And even, skipping, doing skipping with a skipping rope. That's also a way to make sure that there's movement in the lymphatic system as well. Okay, so choose a method that works for you. Practice it daily, because that is one way that you can improve your health. And please, be aware and know that your lymphatic system is a very intricate part of your immune system, right? It includes your lymph nodes. It includes your spleen. It includes your appendix. So these are lymphatic organs. It includes your thymus, which is right here in the anterior chest. That's where the T cells are produced. And sometimes you even can perform what's called a thymus punch, and that helps to kind of activate. It's a part of activating your immune system. But these are things, guys, that you can proactively do to ensure, health in your body. Okay. All right. Thank you guys for listening. Have a wonderful day. And I'm going to go get dressed now. Take care, guys. Bye.